everyone. Can everyone hear me? Okay, my name is Sonika. I'm the genetic counselor at Eastern Biotech. Genetic counseling, I guess, is a pretty new field over here. So what I'd like to do today is just introduce what is genetic counseling and what my role as a genetic counselor would be to maybe assist all of you in dealing with patients and helping to provide them ultimate patient care. What is genetic counseling? Genetic counseling is a communication process between a healthcare professional who is trained in genetics and an individual or a family who is affected by or at risk of an inherited disorder. What are the goals of genetic counseling? Why would you recommend your patients for genetic counseling? Genetic counseling can help the patient understand the medical facts of the genetic condition that is present. It would help to explain the role of hereditary genetics in the expression of the condition that is present and the risk of recurrence of that particular genetic condition in the family or their future pregnancies. The genetic counselor could discuss the options that are available for dealing with the disorder. For example, how they could deal with avoiding passing on the genetic condition in future pregnancies, what they could do with the current pregnancy, how they could manage the condition, assisting these families in choosing the options that are most appropriate for them, given their family background, their social status, their understanding. What a genetic counselor could do is assist them in choosing the options that are most appropriate and most suitable for them, and obviously in providing psychosocial support. Who is a genetic counselor? Genetic counselor is a professional who is trained in the fields of genetics and psychosocial counseling. What a genetic counselor does is we act as advocates for the families who are affected by genetic disorders, and we help educate them and empower them with the information about the genetic condition so that they could help make the best decision for themselves. We help patients understand the concepts of hereditary, so basically help the patients to understand how this particular condition occurred and from where did it come from, and what the condition is all about. We can assist them in planning for treatment of affected individuals, as well as providing options for their future offspring if they wish to stop the passing on of the genetic condition. What does the counselor do? So basically, when I see someone for a genetic counseling session, what would be the first things that I would do? I would review their family history and medical history. I would figure out if the patient or their family members are at risk of a genetic condition. I would explain to them how genetic conditions are passed down through families and from generation to generation. I would find out and give them information about the genetic condition that is present. I would provide them information about the testing, genetic testing, as we've been speaking about all evening, what options are available for them for testing to confirm the diagnosis, and in the first case, help them decide whether they want to go ahead with testing or not. I would offer them guidance to help them make informed decisions and educate them about everything that is available in today's science and technology, and so that they can make the best choices and plan their lives ahead. What I would do is also, obviously, this is a multidisciplinary process, I believe, and I would need all of your help in supporting them, finding referrals to gynecologists, obstetricians as yourselves, and getting a complete patient care. I would also help them find support networks. For example, we have a Down Syndrome Association. We have thalassemia networks, so we can put them through to those networks and support groups so they can get in touch with other families and individuals who are going through the same things that they are. They could talk to other families, other patients, other doctors, and get all the support that they require. When should a patient be referred for genetic counseling? I think we've covered all of this a lot, so I'm just going to skim over this. We all know advanced maternal age, that is 35 years and older, a patient should be referred for genetic counseling. So what I can do is educate them about the testing options that are available, the conditions that they could be at high risk for, and explain to them that there is this testing available and you can go ahead and find out whether your pregnancy is at high risk or diagnose if any condition is present. If a family has a strong history of an inherited condition, such as, for example, cancer, blood disorders, such as thalassemia, neurogenic conditions, etc. If there's a couple who already has a child with a chromosomal abnormality and are planning another pregnancy and would like to avoid passing down or having the same abnormality passing down, you could refer them for genetic counseling, and I could talk to them about prenatal diagnosis options. I think we've all spoken about prenatal diagnosis, but I don't think anyone has really touched about prenatal pre-implantation genetic diagnosis over here. So that is also another option that that couples who are planning another pregnancy and would wish to avoid passing down a genetic condition could have. It's basically a tie-up with IVF, and what is done in pre-implantation genetic diagnosis would follow the same procedure as IVF, but what they would do is before they implant the embryos, before they implant the fertilized embryos, they would do the same molecular testing on the on the 2 to 4 cells embryo, and they would see if that particular genetic condition is present in that embryo or not. And those embryos that are found to be affected by that particular genetic condition would be discarded, while as the ones which are normal would be implanted and would carry on into a pregnancy. So thus you could avoid passing down the genetic condition in future pregnancies. When if a couple has a child, or there is a family where there is a child with short stature, growth delay, overgrowth syndrome, these all are the flags where you would think that, okay, so and so person or this couple or family should be referred to a genetic counselor, so we could help them by taking their family history and analyzing what may be the cause over here, or if we can help them with any form of testing to make a diagnosis. The process would, as I've explained before, would include gathering information about their family, about their medical history, making a family tree, seeing what kind of a condition is it. Is it an autosomal, is it a pattern for an autosomal recessive, for an autosomal dominant, X-linked condition? We would draw the analysis, we would try and figure out what condition it is. We would establish the diagnosis and verify the diagnosis. We would, of course, if there is something like short stature, overgrowth syndrome, we would refer them to a specialist such as yourselves to do the physical examination or do the clinical part of the diagnosis, and we would help them with the genetic part of the diagnosis. As I said, we would do a risk assessment for them. We would give them information about the condition. We would help them and support them by giving them all the information and helping them and empowering them to make an informed choice. We would provide psychosocial assessment and counseling, and genetic counseling goes way beyond pregnancy, birth, and even still after that. Genetic counseling believes in supporting the patient all through and managing the condition all through their life, for future pregnancies, for their children, and it goes on and on. We would follow up with them, and we would provide them resources. We would give them information about new and developing technology so that they know all the information that there is for them to make their life plans. Broadly speaking, genetic counseling obviously is applicable to all forms of genetic testing, but broadly speaking, the areas of genetic counseling are prenatal, as we've discussed in length, cancer counseling, pediatric genetic counseling, and others such as monogenic, that is Mendelian, that is genetic conditions that follow the Mendelian laws of inheritance. Prenatal genetic counseling, I won't go over all of this once again, but just basically to summarize what we've been speaking about, non-invasive prenatal diagnosis could be used for couples where the woman is over 35 years of age. It tests for chromosomal fetal aneuploidies. It is if the woman is found to be high risk on maternal serum screening, or for a couple who has a high risk of pregnancy loss, non-invasive prenatal diagnosis is applicable for all of these couples. Down syndrome, we've spoken a lot about, so once again I'll just brush over this. If I see a couple, a woman who comes into me and I see if one of you refer me a patient who is 35 years old and older, I would consider her to be high risk for chromosomal aneuploidies. I would explain to her that we have non-invasive prenatal diagnosis tests available. If we go ahead and we do the testing, I would explain to her what the test is all about, what kind of information are we getting with the test. That is, we're testing for 3 common chromosomal aneuploidies that she may be at a high risk for. I would explain to her that this is how long the test takes, this is when we will be doing the test, when will we get the results, once we get the results, what options do we have. I think someone was also talking earlier about if we if we do the test and we have a positive result and we find out that the patient is carrying an affected child, what do we do from there? This is what we do in the genetic counseling process. When we speak to the couple or the patient about testing, we also talk to them about what happens when you get the results. So basically preparing them for both a positive and a negative result. If there is a positive result, we get them to start thinking about what would they want to do with that result. How will they plan their life from there on? What would they want to do with the pregnancy? If there's a negative result, well, obviously everyone's happy. The other thing about NIPD, as everyone spoke about, was the early testing, thus we can make a decision earlier if they wish to terminate the pregnancy. It is definitely something which really helps the genetic counselor is early testing, because we deal with very distressed patients who it becomes very difficult for someone at 16 to 18 to 20 weeks to decide to terminate a pregnancy. Thus, if we have an early testing option, it is therefore that much, it's never easy, but it's still a little easier for them to make that choice if they wish to terminate the pregnancy. The specificity, obviously, it's really good for a genetic counselor to be able to very confidently tell their patient that this test will give you highly specific results, and these results are almost 100% accurate. I think we went over the backup results and doing the retesting, so we'll leave that one. Inclusivity, we have 3 common chromosomal aneuploidies that we could test for. Explaining the result, management, follow-up and support, everything that I've already spoken about. Another thing is we see a lot of, I'm sure in your practice as well, you must have seen a lot of quite a few couples who come through who have a history of spontaneous miscarriages without any reason, without any explainable reason. It's found, it says in research, that 50 to 80% of spontaneous abortion is caused by chromosomal abnormalities such as copy number variation and structural aberrance. Testing services are now available for all known microdeletions and microduplication syndromes and chromosomal numerical aberrances that could provide an answer for why are these spontaneous abortions happening. And we have tests available that could help test the pregnancy and see if it is carrying or if the fetus is affected with any of these disorders or any of these syndromes are there, and we could provide genetic counseling for the same. Applications for these are, again, if you see a patient who has a history of recurrent or spontaneous miscarriages, or if you see individuals who seem like they have dysmorphic features, growth delay, developmental delay, it might be indicative of a microdeletion or microduplication syndrome. Or if you see family members of affected individuals who are planning on having children of their own and would like to know that, is this something for us to be worried about? Or is this something, I have so-and-so member in my family, or I have a second or third degree relative who is affected with something like this. We don't know exactly what it is, but there was developmental delay, there was intellectual disability, there was slow growth. Should we be worried? You refer them for genetic counseling. We will take their family history and we will diagnose, and we will make a diagnosis for them whether if there is something over there to be worried about, if there is something to be worried about, what we can do for them, how can we help them with that. And obviously for prenatal diagnosis. Pediatric genetic counseling, I guess not many pediatricians over here, so I'll just run through this one quickly.
We can slow it down.
Okay. I guess I'm talking very fast. All right. So pediatric genetic counseling is the main area of pediatric genetic counseling that we see is in metabolic disorders, which are diagnosed on newborn screening programs mainly, which is when okay, so the most common type of pediatric genetic counseling, as I said, is revolving around inborn errors of metabolism that are picked up on the newborn screening program. In most of these disorders, what happens is that the problem arises due to accumulation of a substance which is toxic or harmful and interferes with the normal functioning of the body, or it reduces the body's ability to break down the toxin. So what happens is that traditionally the inherited metabolic diseases are categorized as disorders of carbohydrate, amino acid, organic acid, or lysosomal storage disorders. In recent decades, hundreds of new inherited disorders of metabolism have been discovered and the categories have proliferated. So basically what is happening over here is that there is a substance that is building up in the body and the body is not able to break it down, and thus it is causing toxicity to the body and interfering with the body's normal functionality. Most metabolic disorders are found to be are inherited in an autosomal recessive pattern. That means if there are parents who are both carriers of the same mutation, there is a 25% chance, that is a 1 in 4 chance, that they may have a child who is affected and who is got the disorder. There is a 50% chance that their children would be carriers such as themselves, and there is a 25% chance that they would have a completely normal child. Metabolic disorders are commonly screened as part of the newborn screening program. An example of a metabolic disorder. This is an example of galactosemia, which is a carbohydrate metabolic disorder. Galactosemia is a sugar that is made up of galactose and lactose, as I'm sure everyone over here knows. It's present in milk products, and if a child is found to have galactosemia, they won't be able to break down the milk products, and the galactose will build up in their body, and it will cause toxicity and other symptoms. What we need to do is, as soon as the person is diagnosed with this problem on the newborn screening program, immediate management should start, and there should be a dietary intervention where you need to cut down and you need to substitute milk with milk products or formulas. Routine monitoring needs to be done, and as usual with any condition, management and surveillance needs to be done. Another pediatric genetic counseling area would be for hematological, that is, for example, thalassemia. I'm sure everyone over here is very well aware with thalassemia. It's again an autosomal recessive disorder, same inheritance pattern as I explained before, also part of the newborn screening program. Genetic testing, although the newborn screening program only diagnoses whether there is thalassemia or not, but the exact gene mutation needs to be identified with the help of molecular genetic testing. And that information can thus be used ahead in prenatal diagnosis or pre-implantation genetic diagnosis. Cancer genetic counseling. Cancer, we all know, are malignant tumors that are developed from accumulation of unregulated cell growth, result of gene mutations or existing gene defects. So cancer has a genetic component and an environmental component. There may be someone who is carrying a cancer mutation but may not express that in all their life. They may not have cancer all their life. But if in hand with environmental factors, if there are environmental factors hand in hand with that, the gene will be triggered to start accelerating cell growth and forming a cancer. A series of genetic testing is available for hereditary cancers such as breast, ovarian, colorectal cancer. Genetic counseling, once again, follows the same process. We would check out the family history, we would see what kind of cancer is present, we will do a risk assessment for the same. We will provide options for testing if the family or if the individual wishes to go for that. We will provide them management and surveillance options. We would refer them to oncologists and specialists in that particular cancer who could help them with other management options. And the other thing that is over here is that we could devise a personalized cancer therapy for that particular individual. How could this be done? As I explained all that before, I'll just skip over that one. Okay, so we can test for polymorphisms of particular cancer gene as known cancer gene mutations. If, for example, we all very commonly know tamoxifen is a very common chemotherapy drug which is prescribed for breast cancer. It is known, though, that the efficacy of tamoxifen depends on what kind of morphism of the CYP2D6 gene is present in an individual. Each individual may be carrying a different polymorphism for this gene, and thus their response to this particular medication, that is tamoxifen, to this drug would be different. So we could test for this. We can test for these polymorphisms, and we can see what drug should be exactly prescribed to this person who is carrying this particular polymorphism. Monogenic disorders, I think someone also did speak about earlier, so I'll just skim over that one. Once again, we will if there is a known genetic condition in the family, you refer the person for genetic counseling. We explain the simple laws of Mendelian inheritance to them. We explain to them where is this condition coming from, how is it being passed down. It's also known that family of specific ethnic backgrounds are more susceptible to particular genetic conditions. For example, cystic fibrosis is one of them, which is very prevalent in Ashkenazi Jewish populations. So these kind of individuals could be referred for genetic counseling so that we could help talk to them about their family history and figure out if there is something that they need to be aware of or that they need to be thinking about. We all know the Mendelian laws of inheritance, I guess. That's recessive inheritance, as I explained before, dominant inheritance. Based on, as someone spoke before, based on the target sequence capture, new generation sequencing is now able to test for 145 diseases, which covers 13 physiological and functional systems. How can this help genetic counseling? Because if some person comes to me and says that, there is some sort of problem, my father had some heart condition, so-and-so person had some diabetes, all that could be mapped out together and one test could be done to determine exactly what condition is there that is existing in the family that is causing all these different symptoms. Obviously, again, we would explain the test to them, we would explain the implications of the results that will be coming. We will do a report analysis with them, management and support, follow-up, as discussed before, prenatal diagnosis, pre-implantation genetic diagnosis. So that's that for me. Genetic counseling, if you need any more information, I'd be more than happy to be working with each and every one of you, and I hope I will get some referrals from you, and obviously I will be using you as well to send my patients to you when I need your services, and when we should be working together as a team to provide the best care that we can for our patients. For more information, you can go to our website, geneticcounseling.ae, and you can also send me a query from there. I hope this loads. You can also send me a query from there, yes, and we'll follow it up and we'll follow through.
Thank you very much, Sonika. Basically, I would like to now request our marketing director, Eastern Biotech and Life Sciences, to give a vote of thanks.
Before vote of thanks, Esther, I would like Dr. Amala to come here first. 1 minute, please. We have still a few questions unanswered.